We felt that in particular children were growing up in these cities with very little in the way of access to physical activity or good food, and a lot of exposure to, for example, tobacco smoke. We know that, that much of what we know about cardiovascular disease is actually decided in childhood. Some say that cardiovascular disease is the adult manifestation of a series of exposures in childhood, and we really wanted to draw attention to that fact, to the fact that CVD is actually a children's issue. At the same time, there's also rheumatic heart disease and other heart diseases that that really do affect children in poor urban settings in particular. And so we wanted to show the focus on those twin tracks of children being either having heart disease at early ages in the case of rheumatic heart disease, or being exposed to, at very early and accelerated paces, to the factors that lead to later presentation of CVD. The outcomes of the report commissioned by the World Heart Federation showed that while there's much convincing evidence that children's heart health is placed at risk by the way they're growing up in large urban settings in low and middle income countries, there's actually much that can be done in terms of policies that are implemented at the city level. It's much easier to implement a policy in an urban environment than it is at the national level, and much easier to foster the type of collaboration that's necessary to ensure those policies are fully implemented. One of the recommendations of the report is something which we're calling the SPACE initiative. SPACE is an acronym for Stakeholder Collaboration, Planning Cities, Access to Healthcare, Child-Focused Dialogue, and Evaluation. So we want to ensure that that stakeholders are all at the table, and that cities are planned with ample physical space to ensure that children can move about safely and get all the exercise they need. Access to healthcare to ensure that they have the full access to health systems that fully treat children as effectively as possible. Child-focused planning and evaluation. One of the reasons that we chose the SPACE initiative, that we chose to focus on children and urbanization and heart health, is because we felt it's an area that has great potential, but is also in need of much more research to show how cities can be places that either hinder heart health or help heart health. So we really hope that in introducing the SPACE concept in our discussions and in our public communications, we can encourage researchers to take on this issue and to address different aspects of it, and that can form the basis for policy change. I've spent a fair bit of time traveling in large urban settings in low and middle income countries. And this is where I really started to think about children and how their health was affected by growing up in particularly in slum areas in low and middle income countries. So for example, in a place like Kailesha in Cape Town, which is a large slum area attached to Cape Town, or in the slums in Mumbai, you see children growing up in very small, cramped settings with very limited access to fresh food, to fresh fruit, to vegetables, eating a lot of street foods that are cooked high in saturated fats and trans fats, for example, and having very limited opportunities for safe physical activity. And I think that's an important part of this. It's one thing to have open space. It's another thing for it to be safe to use it. And so children are growing up in these sort of cramped, unhealthy environments where there's very little in the way of fresh fruit and vegetables available to them, or other elements of a healthy diet, and really having very limited choices in terms of where they go and what they can eat. It really struck me that this is really setting a foundation for poor health. And the reality is that most people are living in large urban settings in low and middle income countries. This is going to increasingly be the reality when you factor in traffic, which you see in places like Mumbai, like Sao Paulo, like any large mega city, where it becomes particularly unsafe and unrealistic for a child to be able to move around safely, it really brings it home that this is something we need to get in front of and start to think about, even though it's a long-term issue that has a lot of factors, a lot of different sectors that need to come to the table and come to solutions. And that's why the Space Initiative is meant to bring together all the different actors and players in this space and start to address children's health in this urban setting at the earliest possible time. One of the reasons we wanted to bring attention to the issue of children and heart health is because increasingly obesity is becoming a problem of children in low and middle income countries. And there's a myth around obesity in children that it's only occurring in high income countries. At the same time, we're seeing in Mexico, for example, it has I believe the second highest childhood obesity rate in the world. And that has to do with the way children are growing up with highly processed foods, with even a lot of trans fats within the street foods that they have available to them, and very limited opportunities for physical activity. In places like China, we're also seeing an increasing occurrence of childhood obesity, even in poorer populations. So on the one hand, there's an issue of increasing prevalence of childhood obesity in low and middle income countries that's directly related to the types of food kids have available to them, to the limited opportunities for exercise. But we're also seeing a co-occurrence of undernutrition and overnutrition. Now, when a mother is malnourished and when her child spends the first few years of life malnourished, what occurs when calories become available to them actually is that they tend to quickly move into being overweight and even obese. This is something around which there's been some very interesting research done recently, and much more research is needed to show that, in fact, a child who is born deprived of calories, a child who exhibits traditional signs of malnourishment, including stunting, once they are given access to calorie-dense foods, actually quickly move into overweight and obesity. And so this shows that in fact the overweight and obesity are issues among children, not just of high-income countries, but very much of poor children in low and middle-income countries.